Hello, everyone. My name is Israel Palencia, and my project is on the effects of exercise on depression. And I'm also going to be looking into if exercise can be used as an adjunct or even an alternative to treating clinical depression. So, first off, I'm going to provide a general overview of what depression is, the causes, the symptoms. Then we're going to look into prevalence in adults and adolescents in the United States. And then we're going to dive into the literature, um, the existing literature, to see what the science says about how exercise can benefit us, or if exercise doesn't benefit us when dealing with symptoms of depression. So first things first, how is depression defined clinically? So depression is a mood disorder that can cause persistent feelings of sadness and or loss of interest. So some plausible causes of depression. So we know that your family history or your genetics can influence this quite a bit. So some people are more genetically predisposed to symptoms of depression than others. And as we also know, your environment can have a big impact on the stress that you perceive and how you are able to manage this stress. So a lot of stressful events can be a cause of depression. And personality traits like low self-esteem can also contribute to these depressive thoughts. Abusing substances like alcohol and cannabis can exacerbate this issue when dealing with stressful events. And now we're going to look into some of the possible symptoms of depression. So we know that depression can have impacts on your mood, can make you feel anxious, guilty, hopeless, can make you have mood swings, and as we said, experience sadness. So we also know it affects your behavior, can make you more irritable, more agitated, make you cry excessively, and cause you to isolate yourself socially. It also has deep effects on your sleeping pattern. So restlessness or even excessive sleepiness are both common symptoms of depression. Now, depression also has an impact on your cognitive ability. So we know that you can experience of lack of concentration and slowness of activity. And then some other symptoms that to look out for depression are poor appetite, overthinking, and even suicidal ideation. This figure here shows us the prevalence of major depressive episode among US adults. And starting with the left side of the figure, we can see that overall, about an 8% of adults in the year 2019, capping off at 2020, experience at least one major depressive episode. And then moving along to the right of this graph, with our subgroups, for our sex subgroup, we can see that females have the highest prevalence with about an 11% about of US females having at least one major depressive episode. And we're looking at how this affects the different ages. We see that young adults um, are found to be most prevalent to at least one major depressive episode. And as these ranges go up, we do see a decrease in this trend. So now moving along to our racial and ethnic groups, we can see that those who identify as biracial or biethnic have the highest prevalence of at least one major depressive episode, with about 16% of US adults that are considered biracial and biethnic experiencing at least one episode. And here again, we can see the points that are the highest on each of the subgroups and should be of the most interest because of the highest risk, as the numbers show. So now that we've seen how depression affects adults in the United States, let's look into how depression affects adolescents in the United States. So this figure, as the previous one, was retrieved from the NIH using data provided by the SAMHSA survey. And again, this figure is looking at the prevalence of at least one major depressive episode in US adolescents in this same year. So now, again, starting on the left side of this graph, we can see that overall, about 17% of US adolescents had at least one major depressive episode. And this is higher than the overall percentage or the overall prevalence of adults. And then moving on to our sex category, we can see that females, again, have the highest prevalence in this group with about a fourth of females having at least one major depressive episode. And moving along to the ages, we see an age range of 12 to 17, and we can see a steady increase in this prevalence as the ages increase, with the group of 16 to 17-year-old having about a 22% prevalence in at least one major depressive episode. So again, along our racial and ethnic groups, we can see that people who identify as biracial or biethnic do experience, again, at least the highest prevalence of at least one major depressive episode, with about a 30% of US adolescents that identify this way having at least one episode. So again, we can see this increase here, and the highest number here, followed by the biracial and biethnic, and then these are all of the highest prevalences in each subgroup. So on the screen now, you can see a figure that was meant to be shared with a general audience, and I will now dive deeper into these figures to provide an explanation for you all on the different effects of exercise on depression. So to begin, what is the effect of exercise on serotonin levels? In this study, researchers conducted a study on mice in which they induced some mice with an OBX treatment. And OBX is a compound that is known to induce depressive symptoms in animals, and mice being the animal of choice in this study. So from the left to the right on the x-axis here, we can see our four different data points, or four different treatment groups. And the sham group all the way to the left, this is the group of mice that were neither required to exercise or induced with the OBX. And as we can see, it has a relative 5-HT protein of 1, because all of the subsequent data points or treatment groups are going to be relative or related to this first one. And then on the y-axis, we have our serotonin levels. So this is how much of the 5-HT protein is expressed. And again, moving along the right axis, along the x-axis on our graph, we can see the sham exercise group. So these were mice that were not induced with the OBX, but were required to exercise, or at least had access to a wheel in which they could exercise. And researchers saw here a significant improvement of the serotonin levels in the rats or mice that exercise, as opposed to the ones that didn't. So now moving on to the right side of the graph with our treatment groups that were induced with this OBX or depressive symptoms, we can see that the mice that were not given the ability to exercise, but were induced with OBX, had a much lower level of serotonin than the control groups, and even the control group that had to, or even the treatment group that had to exercise. And then all the way on the right side of the graph, we can see the animals that were both given the ability to exercise and induced with depressive symptoms. And we can see here that those that were induced with depressive symptoms and exercise had even higher levels of serotonin levels than those that just had depressive symptoms. It wasn't quite as big as the sham exercise, but it is drawing closer to just the sham, the first sham group. And again, we can see that there is statistical significance between the difference of the OBX and the OBX exercise groups, meaning that exercise does have an effect on your serotonin levels. Now we're going to be talking about the intensity of the exercise and how that can affect when treating symptoms of depression. So in this study, Meyer et al. Studied the influence of exercise intensity for improving depressed moods. And we can see on the y-axis that they used the POMS depression rating scale to do so for 3 follow-up periods. And from top to bottom, we can see that The groups are the squares of the quiet rest. The circles are the moderate intensity workouts. The diamonds are the light intensity workouts, and all the way at the bottom, we can see that the hard intensity workouts are the triangles. So as the follow-up periods progressed, between the first and second follow-up period, we can see a decrease in all of the treatment groups for their POMS depression rating, with the harder workouts being at the bottom and the quiet rest being at the top. Now, for our last follow-up period of about 6 months, we can see that all of the treatment groups kind of level off. And while the quiet rest, as shown by the square on the top of these of the red circle here, we can see that they did have a higher rating on average of about 1.5 higher than all of the other treatment groups. But we can see that the intensity of exercise over time does not really have a impact, or harder exercise does not benefit you more than lighter intensity exercises. So while it does show a decreasing trend with the harder exercises at the bottom, this does level off as time passes on. So again, the graph shows that during post-workout, there are trends of lower depression as the intensity increases, but over time, this is not the case. Now we're going to look into the effect of exercise on self-assessed depression. And in this study, Dimio et al. Used the HAM-D depression rating scale, which is a self-assessment scale. And there was a follow-up period of 12 days after the exercise was performed. So the training for this consisted of walking on a treadmill, following an interval training pattern, and it was carried out for 30 minutes per day for 10 days. So at the conclusion of this experiment, the researchers concluded that the aerobic exercise can produce substantial improvement in mood in patients with major depressive disorders in a short amount of time. And this can be shown by the decrease in almost all points from before the workout to 12 days after the workout. Now, we're going to be seeing antidepressants versus exercise in treating for depression, and which one is more effective, and can exercise be used to clinically treat symptoms of depression. So for the methods of this study, researchers had 57 patients that participated in a randomized, single-blind, and controlled clinical trial. And these patients range from ages 18 to 55 years old. So first, patients were randomly allocated to take part in a 4-week program of aerobic exercise. So the exercise group had 29 participants in it, and the control group, who were not required to exercise, had 28 participants in it. So immediately after this randomization, all of the patients started with the SSRI, which are common antidepressants, or drugs that are commonly used to treat depression. And the primary outcome measure was the severity of the symptoms as determined by the HAM-D score, which was shown in the previous study. And again, is a self-assessment score. So for the results of this study, researchers did not find a significant increase in levels of serotonin in aerobic exercise compared to depression. They did, however, find several cardiopulmonary biomarkers that did significantly improve. And among these, they suggested that the most prominent was the VO2 max. Now, while the results do not suggest that exercise shows efficacy as an alternative to antidepressant, they do show potential for using exercise as an adjunct treatment for drug treatments. So adjunct meaning they would go side by side and be used to more effectively, or can potentially be used to more effectively treat these symptoms. Now we're going to get into what Canada is doing to address this issue of increased prevalence of depression and increase prescription of antidepressants. So in Canada, exercise is now clinically recommended as a primary treatment for mild to moderate depression, and the Exercise Depression Toolkit was developed to help healthcare providers integrate these treatment guidelines into their practice. So Glowacki et al. Conducted a case study to evaluate the effectiveness of this toolkit, and physicians were instructed to use the toolkit for about a 4-week period, and this was 6 physicians that participated in the study. And then pre and post intervention phone interviews were conducted with the physicians, and weekly logs were provided to them to track use and satisfaction of interactions with individuals with depression. After carrying out the experiment, the researchers concluded that the researchers found that all healthcare providers used the toolkit at least once, and that participants viewed their interaction when using the toolkit to be successful. Now, all of the participants or the physicians involved in administering the toolkit viewed the toolkit as having relative advantage to helping them discuss the role of exercise in treating depression to their patients. They described it as relatively simple and adaptable to their practical needs. So the success of the toolkit was scored on a range of 0 to 7, and researchers concluded that the average success score for all of the participants was 5.5 out of 7, which they deemed to be a successful usage of this exercise and depression toolkit. Thank you all for coming to my iBiology talk, and I hope that you learn more about the role of exercise in treating depression and how the US can possibly take some of the methods that other countries are using to treat mild to moderate depression. Thank you.